Hello, Namaste. Welcome to Macie's Corner. My name is Mac Patel. Today I'm going to share with you my daily eye care routine, which allowed me to overcome my vision problems. But before I talk about it, I believe it might be of interest to you to know what were my health issues for the past almost 30 years. I was 50 pounds overweight. I had quadruple bypass and 2 stents put in. I had type 2 diabetes, and doctor wanted me to go on insulin, which I didn't. I had high blood pressure and high cholesterol. I was taking more than 15 pills a day for the past 30 years. I got to a state when my stomach, my belly was actually bursting out. I came to the realization that doctors couldn't help me, medicine could not help me, injections could not help me. So I started thinking outside the box. That was in 2018. At the age of 79, I started doing research, and I applied that knowledge on myself. That is, I did experiment on myself, what we call Atma Prayog in Sanskrit. And these are the results. Since May 2019, that is from the age of 80, I'm 50 pounds lighter. I'm disease-free. That is, no more diabetes, no more heart disease, no more cholesterol or blood pressure problem. I'm medicine-free and pills-free. That means any kind of pills, vitamin pills or prescription drugs. I'm injection-free. I'm vaccine-free. I've not taken a single vaccine or a booster. And I'm mask-free, unless there is a compulsory, you have to wear a mask. Now let's move on to my eye issues. In 2012, I had eye surgeries done on both eyes because of infection. But 2-3 years later, I started getting blurry eyes, like a curtain will come down after a while. If I read or do something for an hour or so, and I would not be able to see it properly, or even without doing that, every few days the curtain will come down and be blurry eyes. My eye doctor is a very highly competent eye surgeon, but she ran out of all the ideas or the options to do anything more about it. She said that it's also due to old age. She even hinted that I could go blind, and there was nothing she could do about it. She gave me 3 types of eye drops to take 6 times a day, but it didn't help me. So again, I decided to take matters in my own hands. And I started doing some research. It took me a few months 3 to 4 months to cure my eye problem without any medicine. So here is my daily eye routine that I like to share it with you. I hope it may help you too. Step 1. Cold water treatment. First thing in the morning, what I do is put some cold water in my mouth and then splash my eyes with cold water. What I do in the morning is I use eye cup, put clean cold water in it. This is the eye cup. And then put it right over my eye. Open my eye and close my eye and rotate my eye for a while. And then I do the same thing on the other side. Then once a day, I keep my both feet in the cold water for half an hour to 1 hour. Next thing, pranayama is good for you. That is Anulom Vilom. Those who do not know about how to do Anulom Vilom, what you do is hold your one side of the nostril, take a deep breath with the other nostril, then hold it both for 20 seconds or so, then release the first one and exhale. And then inhale from that again, hold it for 20 seconds, and then exhale from the other nostril. So this is how you would do it. Hold it, release the other side, exhale, inhale from it, keep, hold it for 20 seconds, release the other side, and exhale. So you repeat this back and forth. Do it for 10 minutes or so. That's Anulom Vilom. Then there is Kapalbhati. Kapalbhati, you exhale forcefully and inhale normally. And that you do for 10 minutes, like this. So that takes care of pranayama. Then there is Sirsasana. You stand on your head or your shoulder against the wall. So if this is your head here and this is the wall, then you get up on that, and either you stand on your head or on your shoulder. That you do for 10 minutes to 15 minutes. Next thing you do is acupressure. I'm sure you know about acupressure. Those who do not know, it's the forefinger and the middle finger, let's say of the right hand, represents the right eye and the left eye. So this is the right eye and this is the left eye. When you look it up, right eye, left eye. And the bottom part is, this is the eye. The top part is ear. Here, this is eye. So you put pressure on it like this. So I do it for 2 minutes. You can do it for a minute if you want, or 2 minutes. So right eye, left eye. Then on the other hand, the forefinger is left eye and middle finger is the right eye. So the bottom part again, same thing on both. So on both hands, I do 2 minutes each. That's acupressure. Then the optical nerves are between the first and the second finger, right here. Here. So you apply pressure like this or like that, and that's for optical nerves. So you can do it on both sides. This is optical nerves. I do that for 2 minutes each on each hand. That takes care of acupressure. Now the eye exercises. I do 1 minute each. Move your eyes right, left, right, left, right, left. You do that for a minute. Then look up and down, up, down, up, down, up, down. Then rotate your eyes clockwise and anti-clockwise like this. And then anti-clockwise. Then move your eyes diagonally. That means right top, left bottom. Right top, left bottom. Right top, left bottom. Same thing on the other side. Left top, right bottom. Left top, right bottom. Do that for a minute or 2 minutes. I normally do it for 2 minutes. Then blink your eyes a lot, like this. This, by the way, you should do every 20 minutes or so when you're in front of a screen, whether it's iPhone or a laptop or computer. Then you do eye push-up. The way you do it is that hold your thumb, the thumbnail, right to the tip of your nose and stare at it like this, and then move your thumb away from you and then keep focus on the top of the thumbnail as far as you can go, and then take your focus off and look behind the thumb and focus there to the scenery, whatever, and then bring back your focus again on the tip of the thumb, and then bring the thumb back to the tip of your nose. This you do 10 times. So that takes care of eye push-ups. Then there is head and neck exercise, which is connected to your eyes. So you can do it 1 minute or 2 minutes each. Move your head left, right, left, right, left, right. Then move your head up and down, up, down, up, down, up, down. Then you rotate your head clockwise, anti-clockwise, like this. Clockwise and anti-clockwise. Then you tilt your head left and then right, like this. Next thing is to rotate your shoulders like this, like that, and then backwards. So clockwise and anti-clockwise. So that takes care of head and neck exercise. You do it for 1 minute or 2 minutes each. Then you put eye drops. You can make your own eye drops. This is how you make it. Take 1 spoon of each of amla juice, lemon juice, ginger juice without the skin, white onion juice, and 3 spoons of pure honey. If you mix this up and keep it in a glass bottle, it will last for 2 to 3 months without spoiling. If you want, you can keep it for 1 to 2 months and make it again, make fresh one. Put 1 drop in each eye twice a day. Then there's sun gazing. Gaze at the sun, sunrise or sunset. Never in the bright sun, never. Gaze for 5 minutes. Stare right at the sun, sunset or sunrise. Or you can also do is take a leaf, block the sun, and then look into the sun's redness that is around it. So that's sun gazing. You should do it for 5 minutes. Then do palming. Palming means rub your hands, your palms, for a minute, 30 seconds to a minute. Then make a cup like this and put it on your cheekbones like that. Close your eyes and breathe deep in and out. That's sun gazing. You can breathe for about 2 to 3 minutes. So sun gazing for 5 minutes and do palming for 2 to 3 minutes. Then walk on the grass bare feet for 5 minutes to 10 minutes. Next thing is to take cucumber eye pack. So you shred cucumber or potato or dudhi, lie down and put it on your eyes. Close your eyes and put it on it for about 15 to 30 minutes. I do it for 30 minutes. I'm not going to go deep into scientific reasons for this because we don't have much time. And the last step, tratka, you do it for 7 minutes. Those who do not know what tratka means is that you sit in a dark room, place a candle about 9 inches to 12 inches away from you at your eye level. Sit down with a straight back, keep your back straight, and stare at the flame of the candle. Don't rub your eyes and let the tears roll down your cheeks, but don't touch your eyes, don't close it, stare at it. You do this for 7 minutes, and after that do the palming as I showed you before. Rub for one minute or so and then put your palms on your face. So that takes care of eye routine that I do. It goes fast, one after the other. It becomes a routine. So here it is. What I have to say is that if I can do it, you can too. Wish you the best. Do what you can. Thank you.